Classic FM 94.3 Abuja, the station that plays every song you know. You are in the Classic Lounge. Welcome to the show. My name is Faith, and it's exactly 1 p.m. by my time in the studio, and time for us to get into this conversation that I did tell you that we will be having with a special guest in the studio. COVID-19 is a pandemic that has ravaged the world. It's still ravaging the world. Numbers are going up all over the world, and of course, Nigeria is not without its own numbers going up. The second wave is here, and every day, you see the NCDC put out the numbers. Sometimes it puts fear in the hearts of people. And one of the ways that the world did think about combating this is to be able to have vaccines rolled out, which has started in different parts of the world, in Europe, in the Middle East, in Asia. In America, in Canada is going on, and Africa as well. There are some countries in Africa who have also started their rollout of the vaccine. So where does Nigeria stand where this is concerned? That is what we will be talking about. Remember that you can join the conversation. You can leave your messages via Twitter at Classic FM 943, and you can also drop them via WhatsApp. That's 0909 697 5943. I have in the studio someone who can help us make sense of this and open it all up for us. I have Dr. Bassey Okposen. He is a Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Welcome to the show, sir.
Thank you. Good afternoon, Faith. Good afternoon, Nigerians.
Happy New Year to you, sir.
Same to you.
All right, then. So there's a lot to talk about where the vaccine, is concerned. But we have had several news reports about, vaccines coming in at the end of the month. So let's talk about that first. Is that confirmed? Do we have any vaccines coming in at the end of this month?
Yes, from the COVAX facility. When you talk of the COVAX facility, it's through Global Alliance for Vaccine and Immunization, Gavi. They are a global body that supports countries to introduce new vaccines. They have been supporting Nigeria in the introduction of several other new vaccines. It's one of the windows that Nigeria will also still get vaccines. So the one specifically we're talking about that is expected at the end of the month is through the COVAX facility that is supporting 92 other countries.
Okay. How many doses? How much are we expecting?
About 100,000 doses. Remember the COVID-19 vaccine, the manufacturers are not many. It's a new vaccine. The quantity we have globally are limited. The richer countries have laid down their resources, blocked the manufacturers, and taken a larger quantity of the dose. And so what is happening is, like the no medium countries like where Nigeria is, we are also trying to key into this. We are expecting the one from the COVAX facility at the same time to the Minister of Health and the Executive Director and other stakeholders in the country. We are also making efforts to get additional doses from other manufacturers that be able to meet up with the target of Nigerians to be immunized.
Let's talk about the target. What is the target for Nigeria presently?
For Nigeria, the target is derived from us achieving herd immunity. For us to slow down the transmission and actually interrupt it, we need to build up herd immunity for Nigerians. If we are to wait for reinfections to achieve herd immunity, it will take us more than 10 years to achieve that. And by then, we would have lost a lot of Nigerians. To fast-track herd immunity and slow down transmission, there's need for vaccination so that we can be able to interrupt it in Nigeria. And we are looking at 70% of Nigerians to be reached with the vaccination. So for
70%,
70% of Nigerians target population for
this year.
For this year, we are looking at 40% this year, 2021, and then the remaining 30% in 2022. Okay. So for this year, 2021, the 40% of Nigerians we are looking at will be about 84.5 million Nigerians.
Okay.
And then in 2022, we are looking at 65 million Nigerians to be immunized.
Okay, so basically we're hoping that in 2 years we're able to cover
the 70%,
the 70% target of Nigerians to be able to achieve herd immunity. Yes. The vaccine that is coming in at the end of this month, which is the 100,000 doses you've talked about, which one are we expecting? Exactly, are we expecting the Pfizer BioNTech vaccine, or are we expecting the Moderna vaccine? Which one of them is it?
It's the Pfizer.
The Pfizer.
100,000 doses.
Okay. Speaking about, we'll address, the 100,000 doses, very shortly. But let's talk about the Pfizer vaccine. We know that for the Pfizer vaccine, you have to have below minus 70 degrees, for storage facility, it has to be that cold. Do we have that capacity?
For the Pfizer vaccine coming in, and the storage, there is adequate arrangement to receive the vaccine, keep it safe up to point of vaccination. We have a technical working group in the country that is chaired by the executive director of the MPST, Dr. Faisal. We have the steering strategic group, it's also chaired by him, and we also have in the strategy team the NCDC DG, the NAFDAC DG, the WHO country representative, the UNICEF, and all other stakeholders. They are part of it. And under this, they are supervising the technical working groups that have subcommittees. One of the committees is the subcommittee on logistics and vaccine safety. They're working on a daily basis to ensure that the vaccines that we will receive, both the Pfizer and the other non-Pfizer that will come into the country, will be kept safe. Adequate arrangements have been made to receive the vaccine, store the vaccine, distribute to the point of vaccination, and up to administration to Nigerians. Adequate arrangements have been made for that.
So Nigerians do not, because that is one of the biggest conversations that we've had, the storage capacity, for especially the Pfizer vaccine. Now, talking about the fact that, it's just 100,000 doses, what it means is that basically you're immunizing 50,000 people.
Yes.
Yes, because it's 2 doses per person.
Yes.
Who are the people that, are on track to get this fast 100 doses of vaccines?
Now, for the COVID vaccine introduction in Nigeria, we divide into 4 phases, and this is basically due to the quantity of vaccines being expected at a particular point. For this Q1, we are expecting the Pfizer vaccine, 100,000 doses for 50,000 persons, like you've said. In Q2, we will expect another 12% supply that will come in, then the third quarter 17%, and the fourth quarter last batch that will come in. For this first batch that is coming in, we are targeting as a country our frontline health workers and a few other frontline workers that are highly at risk. For instance, the health workers at the treatment isolation centers, they are at risk of being infected. We give them priority. Our health workers at the urban PSC facilities, the general hospitals that are teaching hospitals that are exposed. And then we look at other frontline health workers like the immigration at the airport that are receiving people that are coming in. And then people like some of the police, people that are on essential duties and so on. So as the quantity of the vaccines come in, this will be targeted. And then once this first group are immunized, we'll move. There are 3 other priority groups which will be immunized in the other phases, which includes the group for the second phase will be those 50 years and above. And why this particular group is that because you see the cases more, the mortality, most of the mortality are found in this age group. More than 46% of the people that die are from this age group. The third group we'll be prioritizing will be those with comorbid conditions that are less than 50 years, because for the 50 years and above, all will be targeted for vaccination. Then less than that, we'll be targeting more those with comorbid conditions. And then the fourth priority that we will be given in the distribution of the vaccine is the burden of the disease. Those states that have high burden of the disease will be given also additional advantage in the distribution because of the risk of the case in such states.
Let's talk about the state's distribution, because I mean there have been reports that have been circulated, and one of the reports indicated, that you have Lagos and Kano as priority. They take like precedence for the distribution. I believe I'm correct with that. If you're looking at the numbers, which of course I'm going to, give you as we go on as well. How did you come about the numbers? Because if we're talking about, epicenters in Nigeria, we know that Lagos and Abuja are the epicenters. Lagos even more so, than any other state in Nigeria. Basically, they have numbers that are busting through the seams. But you have these numbers that have been put out. This number was disclosed by the federal government in the publication alongside the NCDC, and you have Kano State actually taking priority. You have 3,557 talking about the vaccines that will be distributed to states, and then Lagos has 3,131 and so on. How did you come by these numbers? Because if you look at the number of infections, yes, Kano has high cases, but not as much as Lagos or Abuja. So how did they take priority?
Now, remember I just mentioned we have 4 parameters that we use to arrive at who gets what. The burden of the disease is just one priority. Remember, we've mentioned the number of frontline workers. We've mentioned the number of those 50 years and above, those with comorbid. And we have statistics that are available from Nigerian surveys on the NCDC, the Federal Ministry of Health, National Population Commission. So when you pull all of them together, it gives us an indication of what the quantity from what is available will be. From the efforts of the government under the present leadership is to ensure that every eligible Nigerian is reached with this vaccine, whether hard to reach, not hard to reach. And when you look at it, and even in that population, the figure you are giving is the number we are targeting. The doses that are going to those states are double. For instance, the doses that are going to Lagos is 6,232 doses.
Yeah, but that is still less than that for Kano.
For the Kano. Remember, the Kano has a population. Remember when the COVID entered Kano, what happened? There was extra efforts to reduce the tension there. If we allow it, do we want it to get to that stage?
We will start addressing that very shortly, but we need to go on a very... we need to go on the break for that because of the head... All right, Classic FM 94.3 Abuja is the station that you are listening to. My name is Faith, and it is a Situation Lounge. We are talking about the all-important COVID-19 vaccine rollout and Nigeria's plans for that. And I have in the studio, of course, still helping us, give clarity to this issue, Dr. Bassey Okposen. He is the Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Thank you for coming, sir. So let's return to this. I want to talk about the issue of apathy as well, because Nigerians basically are super religious people that believe that, we can pray everything out, and there are people who are ill that wouldn't go to the hospital until it is really dire, and there are some of them who just believe that these vaccines, in some way are there to give you some mark or to put in some microchip or to monitor you or a way to use you as a lab rat. There are all sorts of stories going around. How do you intend to address that?
I think I will just go this way.
Yes.
Number one, there is no doubt that there is nothing God cannot do. 2 is the fact that God has given men and women wisdom to do things and make things easier. If I have a brother in UK, I'm here in Abuja, and no matter how I shout, he will not hear me. But God gave men wisdom, women wisdom. We have phone. We can speak as if we are close. I'll bring it again this way. It's as if from here I want to go to Lokoja. There are bicycles, there are motorcycles, there are tricycles, there are cars, there are trucks. You will get to Lokoja faster if you get a sound car that moves faster than somebody that will go with motorcycle, bicycle, or truck. Some other person will still want to say, I want to trek to Lokoja. Like during the election, remember somebody trekked from Lagos to Abuja. So it depends. So you see, it's a choice. It will always be human nature. Some will say yes to something, some will say no to something. We will have people that will say, no matter what you say, they will say the vaccine is not good. But I want to appeal to Nigerians and advise, it's easier when God has given men, women, wisdom to do something for us to key into it. You say you are not going to take the vaccine. Why are you using phone? Phone was through technology. It's the technology that came in and make things easier. I've heard some, like you say, some will say, why is this vaccine developed faster than what it used to be? It should have been 5 years, 10 years before it comes. And now we will tell some of them, in the 60s, it takes 6 months to go from Nigeria to UK by ship. Now, in 6 hours, your flight has landed in UK. Do you do what you want to do? In the 70s, you will go out early in the morning, 4 a.m. to stand by telephone booth to be able to use your coin to call. Now, in the comfort of your room, your car on the street, you can call anywhere in the world. Again, Nigerians will recall, we had the flu pandemic that claimed several lives years back, and some vaccines were developed. So for the vaccine industry and for COVID-19, which is in a class of the SARS-2 group, the vaccine production is not starting from ground zero. Some work has been done, and with the advancement in technology, it's easier to arrive at successful vaccine trials and administration. For any vaccine to be used, that vaccine must have passed through the 5 clinical stages of trials. The vaccine to be brought to Nigeria is not for trial. I will say this with all humility on behalf of the team, telling Nigerians, nobody is bringing any vaccine for trial. The vaccines that are coming to Nigeria had passed through the 5 stages of clinical trial and certified fit for human use. And when it comes to Nigeria, our own NAFDAC, that we know is brand name, they will further look at this vaccine. They have started some works on the vaccines that we want to come in. They will certify it before it is given to any Nigerians. The vaccines are safe. God heals. He answers prayers, like you started in the comment. But there are faster ways of also doing things that we can help ourselves. So Nigerians, please, when these vaccines are available, they are safe and very effective. And we recommend Nigerians leave whatsoever they have heard and so on and avail themselves for these vaccines to be administered to them.
I mean, all well and good, and I do love your answer. But we also do know that in Nigeria, if you want to get through to people, you work with traditional rulers, you work with religious leaders. Your agency is one of the agencies that is tasked with, the distribution and the logistics and all of that, where this vaccine is concerned. Are you working with those kind of people to make sure that you are passing your information in a way that people, especially in the rural areas, can understand?
Yes, we are. It's part of the strategy. The traditional leaders, religious leaders, their first engagement with PTF and other stakeholders was in December. Then specifically for the vaccine, from Friday, we are having the first, next tomorrow, the first batch of the traditional religious leaders to be engaged again. And then on Monday, another team will be engaged, and Wednesday next week. And recall last week, we engaged with health educators from all the countries. And the following day, Wednesday, we engaged with about 788 academias who are in our universities doing researches and so on. Then on Friday, we engaged with the journalists all over the country and told them about the vaccine. So the same approach by Friday, Monday, and Wednesday next week. We are also going to engage with the traditional religious leaders because we know their role. They played very vital role in polio eradication and other implementation. So they are parts and assets that we're going to use to inform our people. And that's why we are starting all these engagements before the vaccines arrive.
Before the vaccines arrive.
Yes.
Just talking about the vaccines, there have been some things that have been repeated, about the vaccine, some of which are not true, but definitely just want clarity from you. Some people have repeated things like, oh, it alters your DNA or it gives you HIV, of course, citing somebody's issue, as an example. So let's clarify that. Let's address that right now.
Those things are not true. They are not true. Scientists, and we have our own Nigerians that are in some of these industries. And you see, interestingly, before I go straight to that answer, you realize that as we are talking now, there are some rich Nigerians that already travel outside this country, receive these vaccines, and come back.
Yes.
We know, and we are seeing them, and they are safe. So those individuals, like I mentioned from the beginning, people will always say, specifically for these vaccines that are coming in, with the advancement in technology and the previous work done with regard the SARS-2 group of vaccines, what they're doing is picking specific components in the virus that needs to be attacked and fixed it, and it's going straight to address. And once the person is vaccinated, it generates and boosts immunity in the person, and anytime that person is exposed to an infection with the virus, then it has antibodies to fight the infection. And you liken it to like measles. A mother that has taken the baby for vaccination, if for any reason that child is exposed to the measles infection, it's either the child will come down with infection or will just show transient sign of illness and recover. But God bless that mother that the child did not take the measles vaccination. You see the reaction will be wild, and some of them end up dying. So once we take these vaccines, because they are coded to ensure that it addresses the specific component of the virus that causes the infection, the body generates some antibodies to it. Once the person is exposed to infection with the virus, you see the way the person will react to it is very different from somebody who has not developed an antibody.
So basically you're saying it doesn't alter the DNA, it does not infect you with HIV.
It does not infect with HIV.
So it is safe. But speaking about that, let's talk about people who have been infected before with COVID-19 in Nigeria, because there have been research and papers and studies talking about, people who have been infected developing antibodies. Of course, there has not been any clarity as to how long the antibody stays, in the person. For people like that, can they still take the vaccines?
Most of the vaccines that are available now are hybrid vaccines that goes beyond one strain, and the antibodies defend them against the group. And this is not starting with just COVID-19 vaccine. I'll give example again with like rotavirus vaccine. There are so many strains, over 80, but of clinical importance about 18. We have vaccine. Once a child is given the dose of rotavirus vaccine, it prevents against most group of the vaccine. Even the one that in science, you cannot say you know everything. So the child is protected. The same with HPV vaccine. One vaccine that is developed, the way its position is hybrid, it prevents against most strains of that virus. The same is with the COVID-19 vaccine. It's a hybrid vaccine. The strains will always come, the viruses will mutate, that is their characteristic. But once those basic components that stimulate antibodies are stimulated in the system, it attacks most of those strains that will come, whether the current one or the ones in the future.
You've answered my next question, which is asking about, because we know that Luth put out a paper about a new strain of the vaccine of the virus in Nigeria. So you're saying that it will definitely address that as well.
Vaccines.
Yeah, but what I'm asking specifically is for people who have had COVID and recovered. Some of them feel I have antibodies, I do not need the vaccine. Do they still need to get vaccinated?
Now, we have seen examples like the PM of UK. He's been down 2 times. We've also known of some other person that have been down 2 times. Now, There is no harm if somebody, and of course it's happening because we are following trends of what is happening in other countries. These vaccines are hybrid. It's a strain that attacks the individual. The hybrid strain will stimulate antibodies that will attack most strains. It will be an advantage to the person if he still take vaccination to stimulate antibodies in the system that can fight more. Because we are seeing people who are having it being reinfected, and the more they get reinfected also, the more the immunity in their system increases. It's, for instance, you see in the measles vaccination, sorry I'm linking it in.
Yeah.
If you give 100 children measles vaccines, 85 will develop immunity. The rest 15% are still exposed to it, they can get it. If you add a second dose, it takes it to 95%. If you, for any reason during campaign, they take another one, it takes it to about 98%. So the repeated exposure builds up their immunity the more. So if somebody has gotten the COVID-19 disease before, recovered, and the vaccines come, that will not be a contraindication for the person.
For the person not to take it.
Again.
Well, what about pregnant women? You know, can they take these vaccines?
You know, for pregnant women, remember the vaccines have just been released.
Yes. And
being used. Pregnancy takes 9 months. The woman gets pregnant. Pregnancy starts for that 9 months before the baby comes out. We're following up with the Obstetrics and Gynecology Association Global, and with the publication and a press conference of the international president. It's made it very clear that for the pregnancy, they cannot categorically say what the effect will be because they have not passed through cycles of trials and completed but there are trials that are ongoing.
Okay.
But if a woman is pregnant and is very high risk area and is comorbid condition, of course it's better because that woman already has some underlying conditions with the pregnancy to have a chance of taking the vaccines. But if she's very stable and doesn't feel like, so it's not that it's a condition, contraindication.
Yeah.
But the woman is, or the family is in a position to take a decision on what they want. The clinical trials for statements on these category statements is still on by the Okposen Global Association.
Okay. Yeah. Aside, the COVAX facility, you said that Nigeria is working on getting vaccines. We'll wrap this up very soon because I know that you need to go. But, where else are we trying to get vaccines from? There have been reports, which is what I want clarification from you. Reports about Nigeria trying to get vaccines, whether it is from, India or Russia or China. We know that a lot of middle-income countries, especially countries in Africa, whether you're talking about, Egypt, Morocco, and co, or even South Africa, they're looking at getting vaccines from, China, the Sinopharm vaccine, or they're getting from Russia, the Sputnik vaccine. Are we looking at any of those countries as well, to purchase from them?
Yes. From the beginning, I said we are looking at 2 options. The COVAX facility will only support countries with up to 20% of the population in 2021. Any additional doses to be added to that must be the country that will purchase. We are targeting 70%. 50%, 20% will come from COVAX. The additional 20% in 2021 will be purchased by the country, and then in 2022, the remaining 30% will also be purchased by the government. The minister, the entire ministry, and then the regulatory bodies are in touch with countries like Russia, like you said, specifically Sputnik V. They are looking at the options the NAFDAC has requested for their dossier. They are also in talks with the UAE government and for their vaccines. So, and then the regulatory bodies are analyzing what they have there. Is it a vaccine we can use in Nigeria? Once all those ones are sorted out and there is sufficient evidence that those vaccines from those countries are equally safe, which have already been pre-qualified by WHO. Remember, even before the consideration the country is making for recertify, the WHO have already given pre-qualification to these vaccines. That is why the country is even looking at them to also be sure, yes, it's what we can give to Nigerians. So once those investigations, clarifications, certifications are completed, we will now bring in those additional to give to Nigerians and ensure that the target is reached.
It's reached. Okay. So there have also been, we see the stories about it spreads across like, oh, the person took the vaccine and still got infected, and so let's address that. We know that there's supposed to be 2 doses. Is that the reason why the person got infected, because the person took just 1 dose first?
Those are just stories you keep on hearing and will never stop. We have not gotten it, and from the experiences what we have, and like I mentioned, but it's not yet documented in the COVID vaccine.
Yes.
Remember I mentioned, for instance, the measles, where if you give to 100, 85 would develop immunity. It's now that the administration is ongoing that in the nearest future we will now also be, the vaccines are up to 95% have
protection,
95 efficacy, which is very safe. So if it's up to 95%, automatically it's only by 5%. What we're saying is, okay, if 100% took it, 5 or so that might not be able to. So from the trials, for instance, the Pfizer we want to use, that's what the statistics is showing. So that does not mean, that the vaccine is not safe. If you have 100 persons and 95 have a good response, it's good to go.
It's good to go.
At least the number remaining is negligible.
Some
and
people
of course, trust Nigerians' natural immunity. Once they are infected once, twice, they pick up the immunity. And
then go on. So when people get these vaccines, can they still go on wearing their face masks and washing their hands and things like that? Or is it time to let down the guard? Because that's what some people will feel like, got on the vaccine, we can go on.
No. All with capitals.
Okay.
No. They must continue to use their face masks. You see, because, for instance, and like we have said, the non-pharmaceutical interventions, using the face masks, washing your hands regularly, social and physical distancing is a must, because we stand the chances. For instance, if somebody else is infected, and God forbid, the person is among the 5% that did not develop antibody immunity from the vaccine the person received, you stand the chance of being reinfected. Some are healthy carriers, must have been reinfected, but because they have a strong antibody, they didn't come down with it, they are asymptomatic. Because they are not covering their mouth and nose, they keep on spreading to other persons. So it's good to further prevent ourselves and prevent spreading to others, because we might get it, but because we have immunity, we don't come down with it, we become asymptomatic and start spreading to others. So when we are in public places, it's good to cover at all times. Observe the basic IPC skills and rules. I think it's important.
A couple questions so that I can let you go. Do we have any plans for local development of vaccines ourselves as Nigerians?
The NIPRIP is on doing that with biotech. They are working on that.
They're working on that as well. So we can expect, because we also have local illnesses, malaria and LAS and things like that.
There are some Nigerians that have also said they are developing vaccines. NAFDAC is working with them and the rest members of the team.
Okay. To develop that. Do you think that we started this late? Africa seems to be playing catch up where vaccines are concerned, and Nigeria mostly also as well, because we know that countries like South Africa and Egypt and Kenya, they have gotten theirs. Yes. So do you think that we have enough time to be able to get the vaccine that we need and be able to proceed?
The team is working hard on that. I'm sure in the nearest future, the minister will also address the nation on this.
On that.
But the efforts are ongoing.
Last question, and I'll let you go right now. Let's talk about the logistics of it. Moving it from point A to point B. We have carried out successful vaccinations in the past, whether we're talking about polio and things like that. But there are still people who are asking, how exactly are you going to be able to carry this out logistics-wise so that we trust that, we're actually protected?
The strategies we want to use are very clear to the team. Once we receive the mRNA vaccines, the logistic arrangement to store it is there. The arrangement to send to the state is there.
So you're sending to states?
We will also send to the states, because the vaccination will take place in all the states. At the state capitals, there will be 3 sites. And in each of the LGA headquarters, there will be a site.